This is another type of a glucometer we have here at the pharmacy. This is the cheapest, and most patients buy this because it just costs about 1,000 rupees. It doesn't have any date or time settings, and it has no alarm, no lights to indicate higher blood glucose level, no infrared function, and it doesn't even come with a pouch. It's basically a simple, cute kind of a small portable meter that you can use if you are trying to look for a more economical meter. It has only 100 test memories, whereas the AccuCheck meters have 500 memory function. It can store 500 results, and this is also the milligram per deciliter type. As I told you, here in Pakistan we use the traditional units, so all the meters that I've shown have the milligram per deciliter units. Unboxing the product, it has this little plastic seal which you can just peel it off. It has this little 5-year warranty symbol, and it has a warranty card inside the box. It doesn't come with any pouch. Okay, now I've emptied the box, and these are the instructions. The quick reference guide is illustrated as always, because most people illustrate this for people who cannot read this minute font. Then this is the package insert for the lancing device that comes with the product, the warranty card which you fill and return to the manufacturer so that you can claim your warranty, and then this is the user's manual. It's pretty simple, and it's in English only, and it's very easy to use. Then we have this little plastic box. It has no carry case or no pouch, and it's a simple box with on call engraved on it. So you just press this and open the box. This is the meter. This is the most simple kind of meter I've ever seen. It doesn't look very fancy like the AccuCheck meters. Then it has this little CR2032 cell, the coin cell type. Well, to take this off I would require a pair of scissors. It doesn't come out that easy. Oh my god, what have they done? This is the coin. And if you lift this, then you can get the strips. And please do not use strips beyond the expiration date. And again, one disadvantage, because I hate meters that use this chip function, when I do not advise against the use of this meter, but meters like AccuCheck Active and other meters that come with this strip function, this chip, because you cannot use loose strips, because most people cannot afford to buy the whole pack of strips because it's expensive. So what they would do is they would go to a pharmacy and ask for loose strips. Well, it's not recommended that you open the box at the pharmacy, because that way moisture can seep in, but here in Pakistan it's a common practice because of affordability issue. So loose strips can be purchased, but again, if you keep on using the old strip and you purchase loose strips from a pharmacy, like 5 strips you've purchased, and then you use the meter with the old chip, it will not give the correct result, because the chip has to be from the box from which you've used the strips. So if you use this meter, do not go for using loose strips from another box. Buy the whole box of strips and replace the chip. The chip goes here in the slot. After the strips we have 10 lancets. They are pretty much like this. All lancets kind of look like the same. They just different color. And then we have the lancing device. Well, this is exactly this is the lancing device that comes with the Certeza meter that I've shown, GL110. I think and there are pretty similarities between the Certeza meter and this meter, because it just gives readings within the range 20 to 600 milligrams per deciliter. Below that it will say it's low, and low will appear on the screen. Above 600 milligrams per deciliter it will say that it's high. And the lancet is pretty much like the Certeza one. Now looking at the meter, it just has this one button, the power button, the slot to insert the chip, and this is where you insert the battery. I put the battery in, I hope it goes in easily. Well, insert it this way because here it has this little coupling, and you just slide beneath it and press. It gives a beep and they are sealed, and if you open them up you see the strips inside. The strips are very different from the Accucheck Active strips, and it's pretty much like the Accucheck Performa and the Certeza GL110 strips because it has this little window which takes blood in. And again, in the user's manual they recommend that you do not put the drop of blood from above, just touch, and it should be absorbed all the way to this little turquoise mark at the end, the little square. If it's too low in length, then that will not give the correct result, and these are the chips that have to be inserted into the meter. Again, like Accucheck meters, unlike the Accucheck meters where you insert the strip here, this is similar to the Certeza GL110 meter that I've shown because it takes strips from above, and it has no latch to take the strip out. So now, getting the meter ready, you need to insert the chip first into the slot so that it can now recognize your device. Okay, which way do they go in? This way. Yes. Just look at the shape, and it here says 690. Maybe you cannot see it, but it says 690 here, and that should be in this way that it matches with the shape, because the edges are pointed at the end and they are kind of rounded at the bottom, and you just put this in with the meter off and push it in. It locks in. Now the meter is ready to be used. Now again, activating or preparing my lancing device. This is the cap of the lancing device. I don't know how does it go in. Does it go this way, or maybe you just remove this and then use the cap? Yeah, this is how you put this on. The cap, it's a transparent cap. Well, I haven't seen this in the cities or the Accucheck meters. That's nice. It just screws on and off easily. So now I will remove one lancet. Again, take the safety cap off, twist and expose the needle. Put this in the lancing device. It can go any way. Just fix it in. It's like pretty springy, and then you just screw it on like this. Now I will hold this, because if you do not hold this and you try to twist the dial, this rotates here and opens the lancet. You do not want this to happen, so hold it here at the neck and then twist. It again has 5 digits. 5 gives the deepest pierce and 0 is the most shallow, so I usually adjust the lancet at 3. This is the mark, the arrow, and just make sure it coincides with 3. 3 is good. So to activate, you just push, or you just pull this away, the tail, until you hear a click sound, and this turns red or kind of dark orange. Now the device has been activated. So now, inserting the strip in the meter, turn the meter on. It gives all this display. It has to match the display that is drawn on the box. Once it says this, you put the strip in this direction. Just be very gentle and pull it in. Now it's processing. Now it reads the code. 690 is the code. And now it's asking for blood, because you can see this little drop of blood flashing. And now I remove blood. Again, use the sides of your fingers and rotate sides. I've activated the lancing device, and now you just put here and press, and then you massage your finger until blood comes out, and then you just touch blood with the window, and it has taken blood all the way up. And now it counts down from 10 to 1, and then it gives my reading. It's 135 milligrams per deciliter. It doesn't give the date or the time. It has no diary function. You cannot mark your result in any way, before meal readings, after meal readings, no reminders, no nothing. It just gives you a simple reading at the time. And if you want to keep a record of all your readings, then it's best to use a diary. You can just note the time on your wristwatch, the date, and then you can document the result yourself. The meter has no diary function, obviously, because it's cheaper. So the company has taken out functions to reduce its cost. And then you remove the strip and the meter turns off. As easy as this.